Students who don't meet the minimum MET grade won't receive credit for improvement. The Federal Council of Medicine, in a plenary session, approved a resolution preventing medical students lacking minimum knowledge from obtaining professional registration. They are not qualified to serve our population. There were more than 13,000 medical graduates who did not achieve the minimum grade. We have already requested the nominal list from the Ministry of Education, and we will find them. In fact, this is an ongoing battle. We banned 480 new medical school spots in our state because we knew there wasn't adequate infrastructure, and Enamed proved that. We will continue fighting for quality medical education. We can't have professionals who put the health of our population at risk.
Now I ask you the question, who prescribes to the doctor and you carry it out? 13,000 professionals, according to the Enamed results, did not achieve the minimum score and would put lives at risk. It puts the population's lives at risk. So now are you going to trust the doctor colleague 100%? So yes, guys, let's go. This is terrible for everyone. I'm not happy with this news. It's very sad because here's the thing. We know that many people rely on medicine, rely on the doctor. The doctor asks for water stopped, but what now? And a doctor who arrives without knowing the basics and the patient tells me, now what? Now it's up to nursing. We know how things are. Medicine has sunk. I told those who follow me, I already said that medicine was sinking and now it's been proven. Is there a way back, I ask you? Emergency room patients are especially vulnerable. Let's be clear, this won't work. The council can't stop these graduated doctors because they don't know the medical student. He is who he is. Let's say he's the one to blame. It's partly him, partly the institution, and partly the Brazilian system, so there's no way a council can now, after the results, prevent these people from becoming doctors. If you're a doctor coming to discuss this, you can rest assured. Everyone here will get their medical license. The board can't stop the doctors. You can write that down. They won't. There's no reason. I don't know much about the law, but I've heard a lot of people saying this is unconstitutional. What would be constitutional is if the student, when entering the course, was aware that when you finish medical school, take the Enamed exam and don't get a satisfactory score, you won't be able to get your medical license. Saying that. After the result, it's easy to predict that this would happen. Everyone predicted it, did something back then, didn't wait for the result, and now they're saying this. So unfortunately, the Federal Medical Council won't be able to do this now for this group that has graduated. Maybe this will be valid for the next ones. I don't even know if for those who are already in progress, but for those who are starting medical school, I don't know. I'm just saying here, guys, this is terrible. For the healthcare category, this is going to throw healthcare into chaos. There are good doctors. There will always be good doctors. Now, when we have a bunch of doctors who don't have the minimum knowledge, that's going to be bad for the population, the poor. It's not for the rich, it's not for the poor, but the poor are the ones who are going to get screwed by this. Why? The rich guy? He goes to the best hospital and will get a top-level doctor, so having a top Instagram or clinic doesn't matter. If the guy went to a weak college, the people at the top know the good doctors, so who's going to go there? The weaker crowd, unfortunately, will be the general population. This is going to be really bad for the population, and it's going to be really bad for nursing too. We rely on medical professionals as we do on physical therapists, nutritionists, physios, administrators, and lawyers. We work together. Now, when it comes to a patient arriving at the emergency room, when a patient arrives at the emergency room, we work together as a team. But who is it that makes or gives the main diagnosis so we can start working? It's the doctor. But what if the doctor doesn't have this understanding? And now I consider myself a good nurse. I wouldn't let anything wrong happen to my patient, but I can't speak for all of nursing. After all, we don't study to fix a medical problem. We study to care for the patient within the scope of nursing assistance. But now if I didn't study for this and the doctor who did study for it can't do it, so how does it work? So from then on, that's how the care will be, you understand? I understand the position of the Federal Medical Council. They're trying to fix a problem, but it's too late. Who was it that gave in? The Ministry of Education and Culture gave in back then. When a student can't fail in elementary school, a student can't fail in high school. They got rid of the college entrance exam and created the NM. Nursing practice, but the NM comes in, it won't look at the fewest exams from the year 2010. People from the old days know how tough college entrance exams were. Medicine was especially difficult and nursing was very hard too. 2 days of exams, phase 1 and 2, I'm from Minas. For those from the Federal University of Uberlandia, getting in means you worked hard to pass the entrance exam. It's on another level. With 10,000 rays a month today, I can easily get into any medical school. I take the NM, get a score above I don't know how much, I don't know, about 600. That doesn't mean the bar is too high. 600 out of 1,000 is 60%, so it depends on the place. So if we start to analyze in the past, the bar was, but what happens? Let's make it easier for everyone to get a college degree. They managed to do it. Now everyone is doing it. Those who can afford it, those who can't get loans from here, people who are drowning in debt because the government did the following. Oh, great, I'll create a student loan program. I'll help you. Then the guy ends up with a bill of $1 million. But I don't know how much that will be for the government once spread out. So guys, what I want to say is, unfortunately, this has nothing to do with medicine directly, but indirectly as a side effect. This is going to affect our profession. We have our own knowledge issues, and I admit that. I'm here to be fair and truthful, not for myself. That's our situation. I am fighting every day to try to improve what I have managed to get from my nursing colleagues. But when I heard that medicine dropped, it was expected, but now it's public, because when I used to talk about it, I even saw people commenting, "Why didn't you manage to get into medicine?" That wasn't even something I thought about in my past, but anyway, now that it's public, people will start to see that medicine isn't what it was 30 years ago. A doctor from 30 years ago, from 20 years ago, compare. No, we will still have good doctors, many colleagues above average. Excellent guy, there will be people entering medicine this year, next year, and the guy will be outstanding. So this is just for you to understand. You'll have to find a good doctor because having a medical license doesn't mean much. There's also the RQE, which will make things harder but aims to improve things. Next is the medical proficiency exam, already approved by the Senate and now in the House of Representatives. Let's look at this. It's bad for nursing, the public, and everyone. I'm not happy about this. I'm very sad and worried about our future. How is it to know our future the way it is? It's unfortunate, isn't it?